Hello and welcome to this special conversation with the jury member of ZS Prize. ZS is a management consulting and technology firm focused on transforming global healthcare and beyond. It has instituted the ZS Prize to nurture ideas which can solve some of the complex challenges of healthcare access and affordability in India at scale. And I'm very pleased to welcome one of the jury members, Professor K. Srinath Reddy. Professor K. Srinath Reddy is an honorary distinguished professor at the Public Health Foundation of India and also served as its past president. He formerly headed the Department of Cardiology at All India Institute of Medical Sciences. He presently serves as an adjunct professor of epidemiology at Harvard and teaches at other universities across the United States of America and Australia. Professor Reddy, thank you so very much for your time today.
Pleased to be conversing with you.
All right, sir. You've been the president of the Public Health Foundation of India. You're now an honorary distinguished professor with the Institute. And Public Health Foundation of India, or PHFI, is engaged in capacity building in public health, through education, training, research. You were also appointed as an advisor in March 2017 on health to the government of Odisha, and you've been the advisor on health to the government of Andhra Pradesh. Now, the objective of ZS Prize is to solve some of the problems for India when it comes to health and healthcare. So, from your vantage, what would you say are the biggest challenges that India faces today when it comes to healthcare? And then, from a public administration and policy level, what is needed for us to address these challenges?
In terms of the multitude of health challenges that India has, we cover a wide spectrum from maternal and child health issues to child nutrition to a variety of infectious diseases, both acute and chronic, and a rising burden of non-communicable diseases like cardiovascular diseases or heart diseases and stroke, cancers, chronic respiratory diseases and diabetes, and of course, also the big challenge of mental health disorders. Given that we have so many of these public health challenges to confront, in a period of health transition, where we are moving from what can be called the agenda of the Millennium Development Goals to the much broader agenda of the Sustainable Development Goals, we do need to build an efficient, equitable, and empathetic health system which is capable of taking care of all of this. But also keeping in mind that we are now the world's largest population, but with a demographic profile of fairly young people, and this is going to remain so for the next 2 or 3 decades. It is incumbent upon us to keep them healthy as well, not just respond to diseases. So health promotion is across the life course is going to be an important element as well, along with disease prevention, early recognition, and prompt care. So we cover the whole expanse of public health in terms of our mandate now at this point in time. And we have to ensure that we have a health system which is capable of responding to all of this. But one of the challenges also is that India is a large country with a very varied profile, not just of the burden of disease across the states, but also the capacity of the individual health systems across each of the states is very variable in terms of capacity and competence. And therefore, it's absolutely essential that we also make sure that central policies, state actions, all of these are well coordinated in order to reduce the existing inequalities between the states. We just can't focus on national aggregate health indicators. We have to look at disaggregate health indicators, both in terms of geography and also in terms of social classes and gender, and see where the existing health disparities can be bridged, even as we advance in terms of our national aggregate indicators towards better outcomes.
Professor Reddy, you've laid out and the challenges very succinctly. But India's spending on public health is among the lowest globally. How does that impact our outcomes?
Well, this has been an unfortunate feature because we may count it anyway, but for much of this century, we have actually spent only about 0.9% of our GDP. And we know that if we add other elements of health, which are not necessarily within the formal health sector, like water, sanitation, nutrition, air pollution, all of these, we still rise to only about 1.4% of the GDP or so. But more than just the percentage of GDP, what we really need to focus on is what is our total health expenditure and what proportion of it is being spent by the public sector in terms of public financing. And if we see that, we have been spending only about 30% or 25% of government health expenditure as part of the overall health expenditure pie. Some of it, of course, the rest comes from private insurance. But to have had, for much of this century, out-of-pocket expenditure ranging between 62 and 74% doesn't speak well of our health policy. But we know that now there is a proactive effort being made to invest more. The latest estimate of out-of-pocket expenditure is 48% of the total health expenditure is, 48% is the out-of-pocket expenditure according to the latest estimates. But that fall from 62 to 55 to 48 has come in mostly because of increase in capital expenditure, infrastructure. We also need to increase it for operational expenditure and for cost coverage of actual expenses that are being met out of pocket by the people. So therefore, we do need to spend more. One of the false arguments advanced by some of the economists who handle the purse strings is some of the states are not able to spend all the money that is allocated. Some of the central programs also are not able to spend all of the money allocated. So why should we allocate more to you? That is false, because if you have a health system which has been inadequately resourced so far, without adequate human resources to deliver programs, without adequate infrastructure, with stock out of drugs, then you're incapable of adequately absorbing and utilizing the funds. So you need some front-end spending in order to strengthen the health system through a multi-layered, multi-skilled health workforce in adequate numbers, well distributed across the country. You need better infrastructure, you need better equipment. All of that, better availability of drugs and vaccines without stockouts. If that happens, then a well-oiled health system can absorb funds much better, spend them much better with improved health outcomes. So we do need to increase, and the World Health Organization and the World Bank, both of them say very clearly that you cannot achieve universal health coverage unless your out-of-pocket expenditure comes down to 15 to 20% of the total health expenditure. And since much of this cannot come directly from private insurance, the public financing has to go up. So we need to spend more from the public financing, both from central budgets and from the state budgets, if we have to cover this gap.
What are the roadblocks for us in being able to cover this gap, Dr. Reddy? Because right now, as the numbers state, we are at 48% of out-of-pocket expenditure. And, the World Bank, as you pointed out, says that we have to be somewhere around, 15, 20%.
Well, it is absolutely necessary that the center allocates more funds, but the states also need to step up. The 15th Finance Commission, as well as the National Health Policy, have said that the states must spend at least 8% of their total budgets on health. Many of the states are around 4 to 5% or even slightly lower. So the states do need to increase their spending as well, because 2/3 of the total government health expenditure comes from the states. Only 1/3 comes from the center. So both of them need to step up. But we know that they cannot suddenly reach 15 to 20%, but they'll have to make an attempt to try and bridge the gap as quickly as possible over the next decade. But it's also important that we not only have more money for health, but more health for the money. So we need greater efficiency gains, which means that we need better allocative and utilization efficiencies. And that is where spending more on primary healthcare is going to be very important rather than just building large-scale hospitals for tertiary care. And primary healthcare in rural areas has been designed fairly well, but under-resourced over the decades, so it has not functioned well. Urban primary healthcare was not even designed, except for a few cities with some municipal hospitals and dispensaries. So we need to step up our urban primary healthcare as well and connect all types of primary healthcare well in a bidirectional manner to secondary and tertiary healthcare at the district level and the medical college level. Unless we have that kind of a structure functioning well, we will not see the efficiency gains of our health expenditure.
When you look at the market opportunities that exist now, right, when it comes to health tech, because the health tech sector is also evolving quite a bit, how do you see that inputting, into solving some of these challenges? And when it comes to the, health tech sector, what excites you the most?
Well, I think technology is going to be very, very important for bridging several of these gaps in availability, in accessibility, affordability, and quality of health services. So firstly, we know that if you can actually provide technology to frontline health workers and give them the right kind of training to utilize them well, you can actually take primary care to home or close to home, even in relatively remote areas. And they've been working with maternal and child health issues, but they can also handle issues like diabetes and hypertension. Pilot studies and demonstration projects have clearly shown the capacity of the frontline health workers with handheld devices with decision support systems and point-of-care diagnostics available can handle diabetes, hypertension also very effectively. So we need to make sure that they're available everywhere as close to home. Then they should be accessible. Geographical distances and barriers have been problematic in the past, but now telehealth services can bridge some of the gaps for getting even more advanced health services available through consultation, provided there are people in the front line who can utilize them. So accessibility, then affordability. We can actually reduce the cost of care. People don't have to travel long distances. We can give much of the care early on so that you prevent complications of disease developing. You can monitor their progress very well. And the quality of care too. Quality parameters can be built in for close monitoring, and even distance monitoring is possible now with the technology. So all elements of care can be improved upon with appropriate use of technology.
Right. Professor Reddy, frameworks are evolving across the world when it comes to healthcare. From your vantage, what can India learn from the healthcare developments of other nations? And, for India to be self-reliant when it comes to the health tech and emerge as a global healthcare service provider, what can India do?
It is absolutely important for us to be very clearly responsive to the healthcare needs of the people. You may have technologies which may appear very attractive, but if they're not addressing the felt needs of the people and not fitting into the overall health system plans, then those technologies are of no use really. So it's important that those who are developing technologies align themselves very well with the recognized health priorities and the emerging health priorities of the people, of the population that they are serving, and also work closely with the health system to see how operationally they can be utilized. Because ultimately, whatever we want to do will have to be both scientifically credible, but also operationally steerable and financially feasible. And they'll have to be accepted well by the policymakers, by the practitioners, and the people at large. So they have to be politically viable as well. So all of these require the people who are developing the tech to collaborate with multidisciplinary teams to evaluate all these dimensions of the technology they are developing. But fundamentally, they'll have to align their technologies very closely to the health needs, particularly in primary care, because that is where the largest number of beneficiaries will be of any new technology. And that's where you can be actually barrier breaking and problem solving.
We'll pick up on the point, of how health tech and how health tech providers should actually service, people. But you spoke of collaboration, and the Public Health Foundation is a public-private initiative which has evolved collaboratively. So, in that context, can you speak or can you talk about the importance of ZS Prize? In bringing together so many different stakeholders with the same goal, and the sort of impact this has on young entrepreneurs attempting to solve healthcare issues?
Well, I think basically all the attempts now that we are making at enhancing public health efficiencies will have to recognize that they have to be oriented and closely aligned to our health systems and build into the existing health system priorities. So there, we also recognize that we have to train a large number of people across different layers of the health system in order to both appreciate the advantages that technology provides and in order to accommodate the technologies efficiently within the functioning of the health system. So it is important that the ZS Prize, which is actually bringing in multiple stakeholders into play, from policymakers to health system managers, people in the public sector, people in the private sector, all of them who have a fairly close knowledge of how the health system functions and what the priorities are, into a body which then engages with young entrepreneurs, young technology developers, working professionals, students, different categories of people who are excited by the idea of offering technologies to the health system to improve the health of the Indian people and to protect the health of the world, actually, if it is possible. Giving them that kind of an opportunity to deal with multiple people who matter from different perspectives in order to both steer the development of their technologies and to assess what their potential impact might be. But it also gives an advantage to them of mentorship. This is a prize that is offering not only a fair amount of money, about 1.5 million, but not only is actually giving them a fair amount of money, but more importantly, it's giving them mentorship throughout of people who can steer them in the right direction so that the innovative abilities and the entrepreneurial skills can be properly directed to the real problems. And secondly, they're able to consult a variety of stakeholders and get their perspectives on how to fashion their technologies to be put to best use. But then they also get a leg up. Once they've developed the technology, they're connected to different potential users, whether in the government or in the private sector. So there a lot of doors are open for them to carry their technologies further into application and potential uptake by multiple end users. So I think the ZS Prize is actually acting as a wonderful bridge from idea to product and from innovation to impact.
All right, and it is a catalyst, which is helping a whole set of young entrepreneurs to also realize their dream to be able to solve for India, and as you say, perhaps solve for the world. But what would be your advice to participants, when it comes to solving for healthcare in India? You have mentioned a few points, through our conversation, but if you could elaborate.
Firstly, I think it's very important for them to recognize what the current and emerging priorities are and where they can position their innovation in that universe. And secondly, also do a landscape of what other products are available or are rapidly developing in that area so that their own innovation is not superfluous, but is likely to add value in a real sense. Then ensure that what the product that they're creating also has the benefit of multidisciplinary knowledge in order to find out what the potential value and impact is likely to be. And work in teams, that's going to be very important. And ultimately have the real world test of potential impact in the field situation, not only just in the laboratory pilot situation or in a small group, but aligned with the health system for a real world test in the field. In fact, as Louis Pasteur told his young research fellows, and that's the same advice I can offer, keep your enthusiasm, but let strict verification be its constant companion.
That's very good advice, for everyone, Professor Reddy. But this is your the second time that you are associated as a jury with the ZS prize. What attracted you to it, and how was your experience in the inaugural edition?
Well, as people who are public health votaries or advocates, we keep complaining that we are not getting solutions, that we only do the problem diagnostic, but we don't go anywhere further beyond that. This offers the pathway to solutions, real-time solutions, which can be transformational. We recognize, of course, that a lot more things need to be done to strengthen the health system. Technology is one piece. We need a health workforce which is really capable of delivering the services. We need better financing. We need to ensure that drug supply is adequate and there are no stockouts. Lots of things need to be fixed. But we know that technology can be transformational and can actually aid in solving many of the problems that we have now. And the fact that the energy of young people, their innovation and enterprise is being now harnessed through the ZS Prize effort to yield products which are of potential value, which can really enhance the efficiency and equity dimensions of the health system. This is what appealed to me. And the fact that there are multiple constituencies at different levels, from policymakers to practitioners to funders and people who are actually financiers of technologies, all of them are now coming into the ZS Prize process to make sure that whatever innovations are being developed are both appropriately matched to our needs, but also potentially matched to application pathways.
Right. Professor Reddy, thank you so very much for giving us your thoughts, on so many different aspects of not just public health, but also your, involvement in the ZS Prize and also advice to young participants. Thank you very much for your time today.
Most welcome.